Hello, good afternoon. My name is Monica Lipson. I'm the Associate Chief of Staff of Education at the Ann Arbor VA. I'm the Assistant Dean of Graduate Medical Education at the University of Michigan Medical School, as well as a general internist, but probably more important, the mother of 2 children, Grant and Morgan, and the wife of the last 17 years of Andrew Campbell. I'm here today to talk about our new paper that'll be published in the Mayo Clinic Proceedings, Having It All, Medicine and Family. I'd like to acknowledge, more importantly, my collaborators, Rachel Perlman, who is also at the Ann Arbor VA as the Chief of Nephrology and Associate Professor of Internal Medicine at the University of Michigan Medical School, as well as Paula Ross, who is in the Office of Medical Student Education and is a research education specialist. But you have to ask, what got us interested in this topic of medical marriage? Well, starting in about 2008, I realized that I had been married for approximately 10 years. I was on the horizon of celebrating my 10th wedding anniversary. In our paper in the Mayo Clinic Proceedings, we note several contemporary findings. Medicine provides unique stressors as well as protective factors in a life of the medical marriage. We started our data collection and our narrative review looking at a landmark study that was published in the New England Journal. It was a study from Johns Hopkins looking at approximately 1,200 of their graduates. At that time, they found some key factors that increased the risk of divorce among physicians. Those 3 factors were marrying before graduation from medical school, anger management issues, and also a less perceived closeness with one's parents. And they were looking at a data set from the 1940s until the 1960s in terms of their classwork. As we move more contemporaneously over the last 2 decades, there is more work in this area, and there are kind of 3 key notes that we note in our paper. There is this concept of overwork as the norm in many physician relationships. Pushing ourselves until the brink is often the way we think is normal to work. As you know, in the contemporary trends around domestic partnerships, civil unions, the definition of marriage has changed over the last 20 years, and what that means to individuals is just that, what that means to individuals. And more importantly, what we find in medicine, there has to be a true discussion of what roles are, and often those roles had been historically thought of as only women's issues. As you see from this chart here, physicians actually do quite well in the marriage category. 78% of physicians tend to be married overall. They don't stay single very long. And we actually have all of the protected criteria that's often found in the literature regarding what keeps marriages together. We have high income, so we can buy our way out of a lot of problems. We get married at a later age, so people are pretty complete in thinking about themselves. And also, we often have values that we share, and a lot of that has to do, especially when you're in dual physician relationships, values around patient care and the ideals of medicine. We have done some prior work. We had a paper that was published in Academic Medicine and where we did some intensive interviews around academic couples, and we found 4 things that led to marriage success. Moving back to our current paper in Mayo Clinic Proceedings, there is currently contemporary literature. The contemporary literature does not provide young physicians with enough information on how to manage career and family, and this is definitely an area of more research, especially as we move to this idea of what is physician wellness and what does it mean to focus on well-being. Our Canadian colleagues are ahead of this game when they see physician wellness as part of the CanMed roles. In our paper, we also talked about the importance of acknowledging work-life balance and professional fulfillment. And we note many of the protective factors, as I discussed previously, but we must commit to our relationships and intimate partners. And I think in medicine, there's always this slight competing values of career and patients in terms of the traditional models in medicine versus our contemporary modern view of what it means to be an active participant in our intimate relationships. And finally, losing ourselves in our current work is unsuitable for both our families and our patients. And it's unsustainable for the long haul of a physician's career. Having It All, Medicine and Family, you can find that in the Mayo Clinic Proceedings. And I would like to dedicate this to my husband, Andrew Campbell, who really has been a support as I follow through on all of these activities. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.